Hi there, it's April Lee, Chronically Me. I'm a professional patient. I'm not a doctor. I am not a medical professional at all, but I've been dealing with medical issues, doctor's appointments, and a bunch of stuff like that forever. And I wanted to share my experience and what might possibly help you. And now I lost my notes. Give me 1 second. Okay, I literally wrote like a ton of questions down to cover. Oh, here they are. Okay, I've got 2 dogs. Sorry if they start barking. What I'm gonna do, because I really did not manage my time well today, I have a doctor's appointment and I have to leave in probably 15 minutes or so. There's a lot to cover. I'm just gonna go through a few things. If you guys have a question, as I'm talking and you think of something, just pop it in there, please. I'll try to answer it. Again, I'm not a professional. This is not like medical advice to tell you what to do in your medical issue or journey or whatever. It's just to share what I've gone through, what I know, what I've learned, and then you could take that, evaluate it how you want, seek professional advice, okay? Let's see. Okay, number 1 is how to find the right doctor. Oh, goodness. Don't bark, please. How to find the right doctor, and it sounds very simple. What I did to find the doctors to help me in these extremely difficult, very hard to diagnose, challenging type of illnesses is I went to my primary. I already had a primary. Went to him. I trusted him, and I still do. But I went to him, and I asked him for, obviously, as we needed to do certain things or testing, I asked his professional opinion. Who do you know? Who do you recommend? And if there was somebody that he truly trusted and recommended, he would let me know. If he's like, honestly, just pick who you want, then what I would do is I would go online. I would start researching and Googling and finding who's in my insurance, but also kind of just going with who looked right for me as far as location and experience and all of that. Then I would go and I would look at all the reviews, good and bad. Then I would go and I would look at other places. I would compare all of those. Then I would also ask around and see if anyone knew these people. I'd call the front desk and I'd talk to them and kind of see how they are before I even booked an appointment. I would then book the appointment and go in with a bunch of questions ready to go. I would prepare by looking online, researching, so I would know a little bit about what I'm wanting to ask or get out of this appointment. I would keep it in my phone and also have it written down. And I would go into the appointment and, kind of test them out a little bit. I would let them talk and do their thing, and I would be upfront and honest and tell them, look, I really want to get better. I'm looking for answers, and I want to be very thorough, and I don't want to come in every couple of months for 10 or 15 minutes and then do another test. I want to get to the bottom of what's going on with me as soon as possible. So if they were on board and they were proactive and they were very thorough, I would stay with them. After usually about 2 or 3 appointments in, you're gonna know if they are going to kind of drop the ball and give up or be diligent in helping you, and how they feel about you. If they think that, you're kind of crazy or you're a hypochondriac or whatever, you're gonna know. So actually right now I can't, I'm not gonna add anyone in because of the time crunch, but if you have any questions, you can pop it in and I will do my best to answer. If I can't answer it in this video, I will then answer it later, or you could private message me. So finding the right doctor, it's really not, I guess, hard to narrow down doctors and go, but you're gonna know. By the 3rd appointment, if you're getting pushed around and you're not getting answers and you're not any better, you really need to seek out another doctor in that field and find someone who's gonna really help you, because it literally will accelerate your diagnosis, get you better faster, or get you to treatment. And then also connect you with other usually like-minded doctors like that one. I've built an amazing team. I need a team. I've got a lot going on, and it took me like literally about 3 years to get all these people on board. So I've got people at Mayo Clinic. I have local doctors for every condition that I've got. They oversee my care to help me function to the best of my ability within my limitations. And basically what I did is, like I said, I went to the doctor 2-3 times. If it was going nowhere, I'm like, instead of being like down to the dumps or angry at that doctor, I looked for another one. You would not believe when an amazing doctor picks up your case and starts to help you, how much better and quicker you'll get better. And also they will partner with you. They are not your boss. They're not your God. They're your partner. You can question them just as they can question you. So really work and let them know you want someone to work as a team and help guide you, right? But not just boss you around and tell you what to do. So I'm gonna talk on, let's say that you need treatment. I needed migraine treatment. I had a severe migraine with nausea, vomiting, light sensitivity, presyncope, which is blacking out but not fainting, pins and needles, numbing and tingling, blurry vision, double vision, eye pain, neck pain, severe for, I think it was 41 days. 41 days of that. I went to the hospital. I went to the same doctor a couple of times. They tried all the new medications, the ones that are supposed to work instantly to like go in there and try to knock it out. The hospital gave me IVs, nothing worked. I went to my primary care doctor and said, look, can you please recommend a good neurologist? I need to look into something further. Went to the neurologist. They did a couple of things. Then they said, okay, we're going to try injections for migraines. They ran it by insurance. Insurance said no. So I had to pay. I didn't pay out of pocket fully because I couldn't afford it, nor did I want to spend all that money. But I was desperate. So what I did is I went online and I started Googling away, and I found a copay program for migraines, and I went on there and filled everything out. And the doctor told me, he's like, what I'm gonna do is do these injections for you with a trial sample. If it works after 2 rounds, then we know we can submit to insurance again and see if they're gonna cover it. So it started working, and very well, more than anything, got me, at least functioning. I was on Zofran still for nausea, but I didn't have to wear the sunglasses in the house in the dark. I did not have to work in the dark with sunglasses as a hairdresser. And I was starting to actually get some improvement and not feel like I'm like on the verge of vomiting and passing out daily. So that was a must for me. Most people will give up and they're on a narcotic or whatever they can. They're stuck in bed. They can't see straight. They can't take care of their family. They can't function. They're sick as a dog, and they just can't afford it, and they give up and they don't know what to do. So if you're stuck in a place like that, and you need care and treatment, talk to your doctor. If there's a way for them to get a sample of something to get you started, to even help you and then show that it works, then there's ways around you having to pay all this money in addition to insurance. So my insurance finally, after 3 more times denying me, went into, gave me the letter. I decided, well, let me look at why. And I discovered in there they wanted me to try some other medications consistently for a certain amount of weeks, and it had to have failed for this issue. Well, guess what? I noticed it before the doctor did. So I called and I said, I think this is why they're denying me. You need to write up and show them that this other medication we've been doing, that it's not working, and why it's not working, and that's the answer, and I think they're going to approve me. Well, guess what? Within like 3 weeks, I was approved. So now I use the copay program. I didn't have to pay up front because I did have to front like $250 and then try to get it reimbursed, which I did not. And then once it got approved, then I got the copay card. My insurance approved it, so I pay $0 for my migraine treatment. Which also helps my neck and my trapezius nuts and all the problems I have in there. I need that. Right now it's starting to ease up. It lasts exactly 2 months for me. Then it creeps in and I have to do a lot of things and avoid a lot of things to work with it. But without this, I mean, it was bad. I don't know what in the world I would be doing right now. I could not function. I was trying to cook dinner in the dark with blackout glasses, anti-nausea medication, an ice pack, and this is still with a severe debilitating migraine. I just pushed through. Not to say that I should have done that, but I did what I had to do. Anyway, fight for yourself. If it's down to money and insurance not approving, talk to your doctor, be honest with these people. Like, hey, I'm a human being, I'm suffering desperately. What can we do? If they don't know, Google, you'll find an answer somewhere. I also had a severe SIBO infection, and I was insanely sick. It was terrible. It was the worst I've ever been, stomach-wise, and I was very ill. I had all the just everything that you would, if you're detoxing, how you feel like you're dying. And so that right there, I was searching and searching, and finally the doctor said, all right, enough is enough. Insurance isn't covering, nothing else is working. I'm gonna go have all the nurses at all the locations gather you the dosage you need, and you're gonna get the samples, and we're gonna see how you do. Well, I got better. Then I had another bout of it. Guess what? They did it again. If you find a doctor that is good and knowledgeable and has a good rapport with pharmaceutical reps and the medical community, you're going to find a doctor that is going to have samples of things you need. They're going to have resources. They're going to help you, because that medication was going to cost me $1,600 and insurance was not budging, and I did not want to pay that. I could not afford that, and I was super, super sick, and it got me back to work and functioning, and got me better. And then I needed it again. They did it again. So that's another thing. If I've been in a situation where I went to the doctor with my daughter, and they're like, oh, your insurance is invalid. Well, of course it's not. I know my insurance is valid, and I called the insurance 3 times to check before this appointment. I called and made sure. I have to do my background work, because you show up to the appointment, the left hand doesn't know what the right hand is doing. Everybody's busy, nobody communicates well, and there's usually an issue. So she said, you're gonna have to cancel your appointment. I said, no, I'm gonna wait here. Just hold on if you can. I called the insurance. They said, no, everything's fine. It must be a glitch in the system. Have them check again. Of course, she's seeing that it's still denied. And so I said, hold on. So I got on insurance, and I said, look, can you please get me, I'm standing in this office. Can you please get me with a medical, somebody in charge of this so I can get this appointment done today? So she says, okay, gets me on the phone with the head of like billing or whatever in the technical issue, and says, okay, yeah, it's a problem on their end. I can see it. I need you to give them this information. You're going to give me, give you this code. I'll give you my name, and then have them call the head of whoever is their billing, and then let them know, and then you'll be able to be seen. Well, guess what? Within 15 minutes, my daughter kept the same appointment, got her in for what she needed, and it was all done, and it's covered, and it's fixed on the back end. So, don't let the front desk just say, hey, it's how it is. Sometimes there's ways to work around it, especially if they're not in a time crunch and you got a few minutes to kill. Don't give up, and don't just like panic or leave upset and angry and whatever, and now book out 6 more weeks later, whatever you got to do. I'm talking fast, sorry, because I got to cover a lot, trying to cover as much as I can. So I had another issue. I was super sick, and I needed my gallbladder removed, didn't know it. And nobody could help me. I went to the hospitals, ERs, everything. I went to one ER. They said, they tested me for crack, cocaine, and some other things, thinking that I want opioids or I'm addicted to drugs. Meanwhile, I'm suffering in agony because I have, my gallbladder is super, super bad and making me very ill. So I went all over town. This happened for 6 months. Finally, I get an appointment with a surgeon. Everything's set up. I checked with insurance 25 times. I checked with the front desk. I checked with everybody. Got it all lined up. On my way to my appointment, super sick, running fevers, sick. My stomach is out to China. I look like I'm having quadruplets. Can't eat, can't do anything, blacking out here and there. I falling on the walls, can't function, nothing. And this was like my, my last hope here. So the lady calls me on the phone and says, okay, well, something happened. We coded it wrong, and we can't see you for another 3 months. I said, okay, well, in a very nice way, but I stood up for myself, and I said, you're going to see me, because I booked this appointment. I did everything right. Everything's lined up. And if this is just an insurance issue, we can figure it out. When I get there, I'm very sick and the hospital can't help me. Nobody's helping me. And I'm probably going to die if you don't help me. So I'm going to be there. And I went. I showed up. They escorted me to the back to the administrator because the nurse felt threatened for her life. Just because I said, hey, I'm going to show up and I'm going to be seen. I didn't threaten anyone. I was just standing up for myself and saying, let's figure this out when I get there. Meanwhile, I go to the back, the lady's going on and on about how they felt threatened, XYZ. And I said, look, lady, I showed her my stomach. I told her how sick I was. I explained everything to her, and she was like literally in shock about how bloated I was and how sick I looked and was concerned. So she said, let me figure out what happened. So she goes, she gets all the paperwork. She says, this is what happened. Let me call insurance and see if I can get like, some sort of, I don't know, some sort of excused thing because it was a mess up on their end. Long story short, I saw the doctor within the next hour in that office. That doctor said, probably should get this gallbladder removed this, soon. And he's like, I can take you in 3 days. Well, goes to take out the gallbladder. It turns out it was an emergency and I needed it done like then and there. Long story short, I felt a lot better once that gallbladder was out and I needed that surgery. So stand up for yourself. Okay, if you're sick, if you got a sick kid, a sick family member, husband, wife, whatever it is, stand up for yourself. Know, if you have insurance, know your benefits. You can show up and like, oh, sure, we can see you. You're all approved. And you show up and it's like $9,000. Or you have to meet your deductible of $5,500 before you can even like do this, whatever. Know what is going on. When you book an appointment, my advice to you is if it is going to have like a procedure or a test or something, ask them what the CPT code is or whatever the code is. Call your insurance, find out what it's going to be, what's expected, because sometimes the office will charge you more because they're not sure, and then it get refunded. Sometimes they'll say, oh, it's covered, and you show up and it's a lot of money that you cannot afford at that time or whatever the reason. But call insurance, find out what it's going to be, then call the office, make sure you line it up with billing. Okay, it's going to be this, right? Yes. Okay. Now you know it's only going to be $35, or maybe it's going to be $500 or towards your deductible, and you can plan to know, right? So these things are important because medical debt is huge when you don't know what is going on. If you don't know what things are going to cost and you're chronically ill and you can't afford them, at least you could do them and then make a payment plan or something. It's very important that you know what is going on. You're your best advocate if you are not mentally sound or very anxious or have problems focusing or retaining this information. You better get a really good advocate for you that can stand in the gap for you and help you. Obviously, this isn't for your everyday, like I'm going to the doctor for a cold or I'm going to get a birth control or whatever you're doing. This is for people that really need extensive care and want to get answers sooner than later. I'm going to leave it at this because I'm going to be late for my appointment if I don't go. If you are not finding answers and if you have not tried Mayo Clinic, I highly recommend them. I was seeking answers for... It was about 7 years. Went to Mayo Clinic after my doctor worked with me extensively, sent me all over town to everyone in the world. Nobody knew what was wrong. I went to them. They found 4 serious ongoing conditions in a matter of 2 days. They knew all about my life. They looked at all my history. It was the most amazing thing I ever did. Did they help me get all better and fix it all and get rid of it? No. But they brought it to light, so I knew where to go from there, how to find these other doctors to treat me well, and how to live within my new body with this new stuff, and how to also try to overcome some of these things. So, long story short, you are your own best advocate. And if you feel like you can't do that, you need to get somebody, whoever, your spouse, some family member, your mom, your dad, whoever can help you, or a best friend that's a medical professional, and you need to get the care you need to get. You're just as important as anyone else. If you're suffering, and another thing, if you're waiting for an appointment, let's say you have an emergency and you need to be seen and your appointment is in 3 to 6 months. It seems obvious, but do this. Call the office, get on any and every cancellation list that they have. Take the appointment. I don't care when the appointment is, take it, right? Get on the book, get established. Then call, get on everything that they have, both in the office and digital, like on an app or whatever. You can get on that. If it's an app, usually it'll say, oh, hey, you want this appointment, that appointment, whatever. Call every day. Even the office some offices will tell you this. Don't worry about being a pain in the butt. Call in the morning, call in the afternoon, call in the evening. Put a timer on your phone. I have never had to wait more than 3 months max, and these are appointments that were like 7 months to a year out that I got seen. There's times where I got in an appointment and I just moved it up a few times. Finally, instead of waiting like 9 weeks, I was in there in 10 days. So if it's important and it needs to be done and you want to get in sooner, it's worth it. It sounds insane. It sounds like you're nagging, but hey, guess what? Hey, April, yeah, I have blah, blah, blah. They know me because I call them, and I'm not rude. I'm not nasty. I'm not insistent. I'm not annoying. I'm not mean or anything like that. I just say, hey, just checking in, and I get in. So I have like literally another 25 points to get on. If anybody has anything they want me to address medically that could help you in a situation that you're stuck in, or get a medication approved or whatever it is, please private message me, and I will add it to my topics on the next live. I'll try my best to maybe hop on again today if I can, but I gotta go. Have a good day. Bye.